Hi, thank you for joining us for today's webinar, Tips and Tricks Accessing the National Cancer Screening Register. My name is Emily Parsons and I'm a Professional Development Officer with the Primary Health Network. I would like to acknowledge the traditional custodians of this land that I live and work on. For me, that is the Awabakal land, and I'd like to pay respect to First Nations people for their enduring culture and contribution to this vast region. I just wanted to mention that before we start, this session is being recorded. The recording and the PDF slides will become available on our PHN website in the Education Library in the next few days. If we have time at the end, there'll be a Q&A session, so please put your questions in the question box. There is an evaluation that needs to be completed and we would be really grateful if you could complete that. Today presenting for us, we have Amy Callanan, Primary Care Improvement Officer with the PHN. I'll now hand over to Amy.
Thanks, Emily, and welcome everyone to our session this afternoon, and thank you for giving up your afternoon to spend the afternoon with us. Firstly, I'd like to also acknowledge the First Nation traditional owners of the lands on which we're all meeting on today and pay my respects to elders past, present, emerging. I'm also coming to you from the land of the Awabakal people and pay my respects specifically to them and to any First Nation people that are joining us today. Like Emily said, we're going to go through the National Cancer Screening Register and looking at tips and tricks of actually how you can access the register. It is quite a dense presentation today. It has been developed that way so you can utilise it as a bit of a go-to after this session if you're needing assistance to work through accessing the register. So really quickly, I'd just like to go through, for those who aren't aware, what the National Cancer Screening Register is. So it has been in existence for about 20 or so years and supports both the national bowel and cervical screening programs. And the function of it is to send invitations and reminder letters to anyone who's eligible to participate. So for the cervical screening program, it's 25 to 74, and for bowel, it's 50 to 74. It provides that safety net for at-risk people, so they are constantly communicated to via the register regarding their screening and where they're up to. And for clinicians like yourselves, it provides a history of that screening result. So previously, you could access the register via fax, phone, and snail mail. Those functions are still available, but moving with the times and technology, with Telstra Health, they developed up the integrated clinical software option and the healthcare provider portal through the register. So both have the exact same functionality and access to information. So through this portal or through your clinical software, you can access both your patient's bowel and or cervical screening history in real time. You can submit all of your forms electronically, so that communication that you'd normally receive via mail or fax, that actually can be submitted either through your clinical software or the healthcare provider portal. You can manage your patient details. So if your patient has moved address, you can update that through either options, and you can manage their preferences. So for example, you can be added to their communication structure. So you can add your details so you can have all of their communication regarding their pathology and where they're up to with screening through to your practice. Excitingly, for bowel screening, you can order the bowel screening kits to be sent directly to your patients. And you also have the option to bulk order the kits to your practice. So a lot of new functionality within the register that you can access through either the portal or your clinical software. So what to know before you get started? And these are a bit of my go-to tips before you actually commence accessing or utilising the portal. These may not make sense to you right now, but as we go through the presentation, hopefully they click. And when you're trying to access a portal or integrate software in your practice, it will make a little bit more sense. So in PROTA, the National Cancer Screening Register is not an option under My Programs in the HPOS tile. It's located under Available Services. So the majority of you will be using PROTA and HPOS to look at your programs, your PIP, your WIP, registering your patients for the CTG. The register sits outside of HPOS and is sitting always in Available Services. Similarly, HPOS and the register delegations are two separate processes for nurses and non-clinical staff. So with in HPOS, you will request delegation to look up MBS item numbers or access certain functions within HPOS, where the Cancer Screening Register delegation is completely separate. A little problem, not a problem, but just a tip that once you access the register through the healthcare provider portal, there's no functionality to go back. So to go back to the Proda front page and access other services such as HPOS, you need to log out of the register and log back into Proda. So it's just a bit of fiddling around if you're using it that way. What I always suggest to practices that are looking to access the register is set it up through the healthcare provider portal, so through Proda first. And this will all make sense to you in a few moments. So it's a really quick system to access it through Proda. So what you can do is you can be utilising the portal and looking at your patient files while you're looking at integrating the software. There is a number of steps involved in accessing the register through your software, and it involves conversations with your IT provider. So while that work's going on in the background, you can be accessing your patient screening histories through the portal. Basically everything regarding the National Cancer Screening Register setup, including software integration, needs to be done under the organisation's Proda account and done by the responsible officer. So when we get to the section where we're looking at integrating our software and doing that registration process, if you're the RO of the practice, the responsible officer who should be undertaking this activity, you have the option to act as yourself or act as the organisation. You need to act as the organisation to do this section. Couple more points and then we can move on to the nitty gritty. If your patient has aged out of the national screening programs, either bowel or cervical, what we'll need to do, you'll need to advise the relevant program. So once they've aged out, so for example, they've chosen to stop screening at 74, you need to communicate that to the register so the patient stops receiving bowel screening kits or reminders to be have their cervical screening done. And really finally, just a reminder that you are accessing clinical information for your patients against the register. So when we're accessing information, we're wanting to ensure that our systems in practice are enabled. So for example, that our GPs are reviewing those clinical results before they're put into your patient file. If you're wanting any information regarding the guidelines or any information relating to referral pathways for your patients, I will refer you directly to our either Central Coast or Hana New England Health Pathways, which have all the updated information regarding both screening programs, specifically self-collection for cervical screening, the screening regimes and referral pathways. So let's move on firstly to the National Screening Cancer Screening Register, the Healthcare Provider Portal. As I mentioned, it requires access via Proda. So we need to have all of our staff with an active Proda, and we need the registration initially done by our general practitioner. So at least one GP within your practice needs to register for then that delegation process to be provided to either your clinical, so your nursing, or your non-clinical team, so your management admin team. So we need to do a couple of checks and balances before we start asking our GPs to complete the registration process. And this is where our responsible officer comes involved. So our GPs need to ensure that within HPOS, that the GP is linked to the general practice. So the HBO number, the health provider, individual organisation number. This can be done by either the RO or the OMO, our organisation maintenance officer, but the RO is normally our practice manager or our principal GP at the practice. So really quite simply, we are wanting to log into Proda as our RO. We're wanting to go to HPOS and select the My Programs tab. Then we're wanting to look at the Health Identifiers tab on our screen here. Then you'll have another option and where it states we're wanting to manage existing records. you'll come up with this Health Identifiers tab, and we're wanting to look at My Organisation Details. Now here in the HPII link, this should note all of your GPs that are attached to your practice. Now, if your GPs are not sitting there, we just need to add them by linking their provider number, selecting, noting their HPII number, selecting search and confirm. So this basically notes that these GPs are noted against your practice, so then they complete the link to register. For interest sakes, for those who are interested, under this link here in the HPII links is a certificate tab. So if you ever get advised that you need to revoke or reissue your NASH certificate or it has expired, this is a link here where you can request a new certificate. So we've done all the background work. Our GPs have logged into Proda. So we need that one GP to log in, and they're wanting to select the National Cancer Screening Register tile, and here we're wanting to link their account. So we're wanting the first option for them to select, which is the I'm a Health a Medicare provider. We're wanting them to select that we are a general practitioner, and then we'll go to our last screen where it will state that we need just to note their provider number. Select save and link. Basically, that's all the GP needs to do. It's really quite simple and quick, takes less than 2 minutes to do. So now our GP has access to National Cancer Screening Register via the healthcare portal, which is fabulous. This means now that our clinical and non-clinical staff can request delegation. And that is done by the very similar method. Our clinical and non-clinical staff are logging into their own Proda account. They're scrolling down and selecting the National Cancer Screening Register tile, and then they're selecting the third option, which is stating that they're a practice or lab staff acting on behalf of a health professional. Then we're requesting delegation, which is we're wanting to note that GP's provider number that we put in the first screen, hit save and register. At this point, we need our GP to go back into our National Cancer Screening Register tile and approve delegation. So you see how the delegation is different between HPOS and the National Cancer Screening Register. So like I said, our GP has logged back in through our standard method. This is the front page of the National Cancer Screening Register. Now, if you cannot see my little toggle, it is a participant search. That is the front screen of the National Cancer Screening Register when you access it. I've highlighted in green my profile. So our GPs are wanting to select my profile, and then it will show you manage delegations. And any of our staff who have requested delegation can be approved, and if anyone leaves the practice, they can be rejected. So that is how we access the register. Now, this is actually the fun part of what you can view against a participant dashboard. So once you've logged in, so we're looking at logging into Proda, selecting that National Cancer Screening tile, the participant search function will come up here in our top left-hand screen. What we need to do is note our patient's Medicare number, first name, surname, date of birth and sex, and select search. Depending on the patient's age and gender at birth, it will state that they're either participating or eligible to participate in either the bowel or cervical screening program. It will then populate the screen below, which is our dummy patient, Jane Citizen, and it shows what she's eligible for. For every patient will look like this screen depending on what they're eligible for. So going in a clockwise position, our program. So we can toggle between the bowel and cervical screening programs if they're eligible for both. Both screens look the exact same. Our participant overview, so it will provide details of our patients' demographics when they have been last screened and when they're next due for screening. If the patient is overdue, it will just state overdue, and there's now a function where there's a bit of a traffic light system which highlights if the patient has either a positive FOBT, has an intermediate risk, or requires further screening. In here where we have the forms, which is stated down here, this actually shows you all of our patient details in terms of their screening history. So here on the right-hand column here, we can actually look at the action and view. So viewing is looking at that complete pathology report that has been provided after a patient has been screened. And you can look at the patient's full screening history. Since they were back for bowel screening, it goes back to their first screen. For cervical screening, even though we are doing HPV screening now and not pap smears, it will have a compressed file of all of their 2-yearly pap screens in there as well. From here, you can download those reports and import them back into the GP's inbox for them to review and for them to be saved back into the patient's file correctly. In the correspondence, this is where all information is stored that has been sent to the patient. So, for example, our invitation, our reminder letters, and when FOBT kits have been sent. Excitingly, in the Forms tab, I should state, here where it says choose a form, under the bowel screening tab, it will actually allow you to select resend a bowel screening kit, and that kit can be sent directly to the patient. Similarly, our patient details, the participant details, you can update their details and from their address to any nominated healthcare providers. So for example, if they're seeing a specialist and yourself, you can note both of you against the patient file, and they actually can receive information to your practice or the specialist rooms. So this is how it actually works. Like I said, everything is in PDF format, so it isn't in that HL7 format to actually embed into your clinical software when you download. It is an actual PDF for you to actually view yourself. So, like I mentioned earlier, we can actually, new function in the National Cancer Screening Register is that you can bulk order FOBT kits under the alternative access model. So this is really quite simple. Anyone in the practice can log back in once you've been delegated, select the National Cancer Screening tile, and in the top right-hand corner, you've got the FOBT bulk order. It brings you a screen basically stating that you have you are requiring to order kits, you have undertaken the training that is required to be completed prior to ordering the kits. That training is really quite simple. The link is on the top of your screen here, and it just talks about those conversations that you should be having with your patients when you're discussing bowel screening, especially against the National Cancer Screening Register. Here on our next screen, it will ask you for kit details. So you can order 10 to 100 kits. It's normally 30 per provider that you can order. When you're ordering, take into consideration your storage and how frequently you'll be giving those out to your patients. They normally have about a 7-month expiry on them. So just be mindful if you are actually going to be able to utilise them at the time. Hit next and submit. So that is actually looking at the healthcare provider portal. So moving on really quickly to software integration. So the exact same functionality within the software integration, but it's only at this present moment with Best Practice Medical Director and Communicare, and your software needs to be at the version stated on your screen or greater. The likes of ZMed and Genie software can come on board. It's just a matter of the register Telstra Health and your software vendor having that conversation and ensuring that we can configure that. So this is a bit of a two-step process. We need to register your practice in the clinical information system integration. It's a mouthful, I know, and that's what our responsible officer needs to do. The final thing is enabling the register function within your clinical software, and that's referring you to your IT provider for all that technical information for them to do in the background. But I hope you're not surprised that I call it some pre-registration requirements before you actually look at integrating your software. So this is our responsible officer's job to do. Your responsible officer needs to check to ensure that they're either an associate or an authorised person against the Australian Business Register. And we need to make sure that their name against the ABR is the exact same as their PRODA details. So we need to make sure the names are the exact same. That they've registered the organisation in PRODA, which we can show you how to do. The RO is listed as a member of the organisation, such as an associate or director. that we've linked the National Cancer Screening Register as a service provider. And like I mentioned earlier, this all needs to be done under the organisation. So when our responsible officer logs into PRODA, they'll have those two options of acting as the individual or the organisation. We need them to act as the organisation. So if this makes absolutely no sense and you have no idea what I'm talking about, that's completely fine. Once you've logged into PRODA, in the top right-hand corner, you will have a tab that says Organisations. Now, one of two options will occur. The first will say My Organisations, and you haven't registered the organisation in PRODA. And this top screen will come up, which will say Join an organisation or Register an organisation. That's when you need to figure out whether you've actually had your practice set up in PRODA. And if not, it's a really quick process to go through to register the organisation. You'll need to know details from the ABR. There are 3 questions that security questions you would have answered against the ABR, which you need to be mindful of. Once that's all done, you'll be able to have a screen like the one below, that if you have set up your practice, it will look like this. And there'll be a hyperlink that says your practice name, say Smith Street General Practice, and it will state your role against the practice. So it should say here that you're an active director or you're an active associate, and that ticks off our boxes that we've actually noted that against the practice. Once you have selected the hyperlink for your practice, it will say Manage My Organisation, which our screen says on the right-hand side. And you'll go down to the bottom where it says Service Provider, and you're wanting to add a service provider. Once you do that, a screen will pop up and it will actually state the National Cancer Screening Register. Once you've done that, you are good to go. So there are 2 options, again, to complete that first-time registration. Now, if you haven't used Healthcare Provider Portal before, there was one option, but if you have access to the register via the Healthcare Provider Portal, this is a very simple option. So I hope this makes a bit of sense to you. So if you're a first-time user, you haven't actually used access the register in the Healthcare Provider Portal, you need to log in, select the National Cancer Screening Register. It's quite monotonous and repetitive, but you're selecting the bottom option that you're wanting to register the organisation. You're wanting to then select and register your HPIO, which is noting that so that 16-digit number that starts with 8003. Then a screen will come up asking for your HPIO details. Now, it will go through just the general details of your practice, like your address, your contact details, how many clinical users at the practice. The most important details to marry up is that your organisation name and your ABN. Once that's done, you will select the terms and conditions, basically that you agree this information is correct, and hitting submit. At this point, you can then engage your IT provider to work in the background to enable the National Cancer Screening Register function within your software. So if you do have access to the Healthcare Provider Portal, your option's quite simple. So you're logging in and selecting the Cancer Screening Register tile, and then you're going up into My Profile, and then you're selecting Manage Practice, and you're just wanting to add the HPIO number. It will come up with this screen that says Register. You'll add in that 16-digit number starting with 8003 and hitting Register. Now, sometimes you'll come up with the screen that I showed before. We had that details, we needed to note the practice details. Sometimes it will just let you register and it's completely gone through perfectly. Similarly, once you've done that, you can move on and speak to your IT provider. Once you've spoken to your IT provider, this is what the register will look like in Best Practice, Medical Director and Communicare. The function is the exact same across the 3 programs, and I've heard specifically Communicare, it works and functions quite beautifully against Communicare software. So for Best Practice, it is a drop-down option at the top of your screen in the clinical tab, I do believe. Don't hold me to that, I always get that wrong. And it will say the National Cancer Screening Register or NCSR when you're in a patient file. It will then populate this screen and you'll be able to do the exact same things you do in the the healthcare provider portal, so be able to view patient results, see when they were last screened, correspond back to the register, so completing forms, so that choose a form tab. In best practice, and I cannot confirm with Communicare or best practice, but in best practice you can actually save those patient results directly into their patient file. Knowing full well that you still need to undertake that process so those results are clinically reviewed, and we need to make sure that cervical screening tab has been completed for your software to recognise that they have been screened. Similar to Medical Director and Best and Communicare, the hyperlinks, the tabs are still there. You can order those FOBT kits directly to the patient, and you can toggle between the two programs. And for all options, you can correspond back to the register through this function and not through the mails, snail mail and corresponding that way. You still can access it through that way. You will still receive mail from the register, but you can correspond back through this method here. So I know it has been a bit of a dump of information, but really importantly, once you've had access to the register, you need to start thinking about how you can utilise it in your general practice. So I look at it in two ways. We can look at the register opportunistically using it or systematically. So we can use it opportunistically either through the healthcare provider portal or software integration, where we can utilise it to complete new patient forms and new patient consults. We can embed it into health assessments, specifically our 715 health assessments, and our GP MP inclusion, so actually putting that into our care. So it's not just an additional thing that you need to think about doing, it's all embedded and put into one system that you have in the practice. You can also use it to create actions and alerts to remind patients that they are due for screening. Where we can look at it systematically, so we're looking at data cleansing, so we can utilise CAT4 with the assistance of either myself or your primary care improvement officer to identify patients who are under-screened or had never been screened. And then we can discuss your patients of focus, whether you'd like to focus on patients who have missed cervical screening between the ages of 25 to 30, or you want to look at patients who are exiting screening and you want to focus on them. There's no right or wrong way to focus on screening. It's up to what you would like to prefer to do. We do have to acknowledge the last few years that screening has been significantly on the download because of COVID, but now is a fabulous time to look at doing some effective reminders and having those conversations with your patients. Obviously, the work that we can do with you and the work you do with the register and cleaning up your patient files and looking at providing that proactive preventative healthcare meets things like your accreditation standards, your quality improvement, and your My Health record practice incentives. So if you would like help in that space, or once you have access to the register, you're wanting to think of how you can use it more proactively, please reach out to either myself or your PCO. If you're needing more help or things don't seem to be marrying up at all, you're not quite sure what your HPRI number is, or you can't see specific tiles to access the register, there's quite a few options. We can speak to our health services and speak to PRODA or the Healthcare Identifier Service hotline directly to figure out those types of things. The Cancer Screening Register still has their website with some fabulous resources. They have an assistance tool which they can help promote in if you'd like to, and they still have their 1-800 number and responding via mail. And like I mentioned, the PHN, your primary care improvement officer specifically, is more than happy to help you get connected and work with this in practice with you. But I guess the take-home message is, please don't stress. If this has gone all over your head, please don't be alarmed. We can look after you and support you in your practice, access the register quite seamlessly for you to use for everyday patients. And that's it. I know I use a lot of our time up today, but I will hand back to Emily.
Thanks, Amy, for that presentation. We do have a couple of questions. So the first one is, are we able to print this presentation? So you will be able to see the presentation on the PHN website. If you go to the top tab under Education, you will see Education Library. And if you click on that, you will see the recording of this presentation and the PDF document. But give it a day for us to get that uploaded. And the second question was for you, Amy. How can you remove someone from cervical screening if they have had a hysterectomy?
So they should technically be removed, but we know the system's only as good as how you use it. So there is, if you look at the healthcare provider portal or through the integrated software, there is an option that says choose a form. And in that, and I will get the name of the form wrong, but it's basically a form to exit the patient from the program. And there's normally an option to say they've exited for this reason and they've had a hysterectomy or they no longer require screening, or they're on another screening regime. So you will need, and that's the same for patients who've had any form of surgeries that removes them from screening, or if they need to exit screening, it's that one form that needs to be completed. I hope that makes sense.
Thanks, Amy. Okay, well, we don't have any more questions, so we'll end it there. Thanks, everybody, for attending today. And thank you again, Amy, for presenting.
You're welcome. Thank you.